Hi, everyone. I'm Dr. Samantha, the maternity mentor, and welcome back to another one of our live Q&A sessions that we do here every Monday at 9 p.m. Eastern Standard Time. This is our chance to go ahead and answer some of your questions live, as well as answer some of the questions that you have submitted on our videos this past week. Please subscribe to the channel because we are putting out content all the time. So if you hit that notification button, you can get notified of our latest videos. Remember to pop over to Facebook, Instagram, and Twitter. We post additional content there. And so we're looking forward to talking with you guys tonight. Remember, if you have any questions, please feel free to put them into the chat. I'm going to go ahead and get started because we have a lot of questions that have come in over the week. So the first question that we have has to do with labor and delivery. So I am 39 weeks pregnant and I'm having back pains and abdominal pains. Is this a sign of labor? So yes, this is a sign of labor. Very traditionally, one of the first signs that we will see is pain when you're in labor. And it can be a couple different kinds of pain. So first you can have like a cramping pain, kind of like your belly is tightening and then relaxing again. So some people will even joke that their belly is hard as a rock. And so it just contracts and then relaxes. Other people will get back pain. So this back pain is in the lower back. It feels as if you strained your back, which can be kind of confusing. But the difference to really look for is that back pain will come and go. The next type of pain that you might feel is you might actually feel cramping as like in your period. And those are usually very low and in the front of your belly. And again, they will come and go. This is one of the key factors to labor pains, is that these pains are not constant. They are coming and going. Now, if you get severe abdominal pain or sharp abdominal pains that are not going away, you need to go to the emergency room. This could be a sign of a placenta issue, including a placental abruption, which is where the placenta tears away from the uterine wall. This is a medical emergency and it needs to be taken care of right away. But ultimately, back pains and stomach pains are usually a sign of labor, especially at 39 weeks. Another question that we got this week was about hemorrhoids. And it said, I'm 38 weeks pregnant, and this is my first pregnancy. I suddenly developed external hemorrhoids. Before this, I was performing Kegel exercises, squat exercises, and yoga for my normal delivery. Should I quit these exercises? My hemorrhoids feel worsen after doing squat exercises and especially yoga. So this is a great question. So for anybody who doesn't know, hemorrhoids are basically enlarged blood vessels, but they're around the rectum. And so what happens is, especially during pregnancy, women tend to get very constipated. And what happens is they push when they go to poop. And that pushing causes those vessels to dilate even more, and they end up pouching, and that is a hemorrhoid. And they're very painful. Hemorrhoids can actually tear and bleed, and they can actually lead to infection. Now, in this case, she mentioned that she suddenly developed an external hemorrhoid. Most likely, what actually happened is she had an internal hemorrhoid that was right there that kind of popped out to the outside. Either which way, because they can develop spontaneously, this is something that can be quite painful and is something that is going to be quite difficult to deal with during a vaginal delivery. Now, you can still have a vaginal delivery with a hemorrhoid, but that pushing might make it worse. What she is asking about Kegels. So Kegel exercises is the internal clenching of the muscles that take care of your bladder. So the muscles that help close the bladder off and open it back up to pee. Kegel exercise shouldn't affect hemorrhoids at all, and I would encourage you to keep doing them. However, squatting and yoga makes sense why it hurts. So when you squat, it actually puts pressure down on the vaginal area and the anal area. So it's putting pressure onto that hemorrhoid. Additionally, the anus may open up just a little bit, which also would shift the position of the hemorrhoid, possibly causing pain. So I wouldn't be doing any more squatting. Also, if the yoga feels even worse than the squatting, you shouldn't do it. Your body's telling you that this is uncomfortable and this is not something you want to be doing. So when you push during a vaginal delivery, you can cause hemorrhoids right then and there, or you can make existing hemorrhoids worse. So one of the things I would encourage you to do, especially since you are 38 weeks pregnant, is contact your healthcare provider and see if you can use some over-the-counter products to try to shrink that hemorrhoid before delivery. One of the things you can use is witch hazel, which is often in the form of Tuck's hemorrhoid pads. This is a very homeopathic way to go ahead and put something topical on that area. The Tuck's pads, the witch hazel is actually very soothing, but it also helps to shrink that hemorrhoid a little bit. And that can be a really homeopathic way to start to deal with that. Sometimes they may also give you a hemorrhoid cream, and that also may help with your pain. So I would go ahead and ask if you can use those ahead of time, because shrinking down that tissue and relieving some of that pain really might make your delivery more comfortable. So that was a great question. So we have a question about postpartum bleeding. The person said, well, it's more of a comment, but she said, I started spotting 3 days after giving birth. It's been a week now and still no bleeding. So when you have a baby, we expect to see some bleeding. There is a difference when you have a cesarean section delivery versus a vaginal birth. So cesarean section deliveries, which are the surgical deliveries of our babies, what happens is when they go to close you up before they're done with the surgery, they'll actually suction out any blood that they can kind of see inside your uterus. So as a result, some women will bleed less because of this, because they kind of clean all that stuff out. So that's like really cool, because then you might not see any bleeding at all. For vaginal deliveries, you'll usually have really heavy bleeding for the first 3 hours. After that, the bleeding for both a cesarean section and a vaginal birth usually looks like a heavy period for about a day. So a heavy period. When you're going into the bathroom every 3 hours, you're filling the entire pad. You might see little teeny tiny clots or clumps of blood. That can be normal. Now, after the first 3 hours, after the first 24 hours, it usually turns into like a period. So you're going through, you would be kind of filling up the middle of the pad every time you go to the bathroom. And then it lightens up from there. And it goes from a dark bright red to a pink to a light pink to a clear. Bleeding can take up to 6 weeks postpartum before it finally resolves. It should never go from heavy to light to heavy again. That's a sign that there's something going on. You also really shouldn't be passing clots after a couple days. So however, if you're not having any bleeding after a week, that might be normal for you for a variety of reasons. If you're not having any fever, no pain, no real adverse effects, it might just be that you just clotted off very easily. I would point this out to your healthcare provider and let them know what's going on, because it is strange. And you want to make sure that maybe you haven't clotted off and there's a whole bunch of blood sitting up in your uterus that hasn't come out. And that is possible. So I would contact your healthcare provider, but it really could be just normal for you. So let's see here. We have a question about signs of labor. So it said, what if my due date is August 23rd, but on August 12th, I saw clear water coming from my private parts? Is that normal or not? So clear water coming from the vaginal area sounds like amniotic fluid. If you see any fluid coming from the vaginal area, no matter where you are in your pregnancy, you want to get that checked out. But especially by the time you're at 37, 38 weeks, it's very likely that your water has broken. Now, why is that important? So our babies can live without the amniotic fluid inside our bellies. But that amniotic fluid, it's a bubble that holds the baby in place during your pregnancy. And one of the things it's supposed to do is protect your baby from the bacteria of the outside world. So our vaginas have bacteria in them, and that bacteria can creep up through the cervix and into the uterus. And so that amniotic fluid sac is one more way to protect the baby from that bacteria. Once your amniotic sac ruptures or your water breaks, now the baby doesn't have that protective layer anymore. So that bacteria can start to enter into the baby's system. And if that happens, your baby could develop sepsis. So usually in the hospital, once a woman's water breaks, we put a timer on the clock basically. And after 12 to 18 hours, depends on the hospital, they'll start IV antibiotics on the mom to help prevent an infection in her and the baby. And after 24 to 36 hours, they're going to suggest a cesarean section delivery if mom hasn't progressed enough to have the baby vaginally. So this is very common practice, and it's because there's a risk of sepsis to both mom and baby. This is why it's so important that if you think your water may have broken, you need to go and get it checked out. There's super simple tests that they can do to determine whether your water's broken. For one, there is a little piece of paper that they'll lay against that fluid on your vagina to check. And amniotic fluid has a different pH level than, say, pee or semen or other things. So they can sometimes tell that way. However, science has come a long way, and they don't always use that as the definitive answer. The other thing is there's now kits where you can collect some of that fluid, send it to a lab to see what kind of fluid is it. And so what we would do is we would examine you using a speculum, which is the device that kind of opens up the vagina so we can see the cervix. We take a cotton swab, we swab that fluid, we send it off. And then if you haven't, if your water hasn't broken, they should be able to determine what's going on, whether it's semen, whether it's urine. Those are the two most common things. And don't feel bad or embarrassed if it is urine. There's so many people who show up to labor and delivery not sure, and it turns out that they might have had a little bit of an accident. You know, when you have a big, heavy baby pushing on your bladder and you laugh, you might pee on yourself. So don't feel bad if that's what it ends up being. It's really normal and it happens a lot. So that was a great question. For any of you who are joining us right now, remember, please feel free to go ahead and put your questions into the chat. So we had another question that came up, and it was about water for formula. It said, hi, can I use Aquafina mineral water for mixing baby formula for my 3-month-old? Also, should I boil Aquafina bottled water? So I'm going to tell you that I don't, if you look it up, you can use Aquafina, but really you want to be careful with any of the mineral waters. So your baby's formula has vitamins and minerals in it. And if you add mineral water to that, you may overload the baby's system with extra minerals that the baby can't process. So really you want to stick to straight old like spring water or tap water. You don't want anything added into it. Now, if this is water that's been filtered, you probably don't need to do anything else to it. However, if it makes you feel more comfortable, and for a lot of parents it does, you can go ahead and boil it. Nowadays, what a lot of parents will do is they'll take the water, they boil it, and then they put it into one of those thermoses, those thermal thermoses that will keep it hot all day long. And then all they have to do is they need to make a bottle is they just pour some of that water that's been pre-boiled into the bottle. So you're not boiling water all day long. You're keeping it warm all day long and making it super easy for yourself. So what I would tell you is I find that most parents feel more comfortable when they boil the water. Just boil the water. It's super easy. But yes, you want to stick more to a spring water and not anything that's loaded with like minerals. These mineral waters may overload your baby's kidneys and liver, and that's not something you want to do. For those of you who are joining us, welcome. Please feel free to ask any questions that you have by putting them into the chat. Okay. So we had another question that I thought was really, really great. And this was about inductions. It came from a viewer. It was a simple question. Do inductions hurt? And so I thought this was a really good thing because a lot of us get induced. So what happens with this question is it depends on the type of induction. So there's a couple of different things that we sometimes do. For starters, there's Cervidil. So Cervidil is this little piece of cloth. They kind of compare it to looking like a flat tampon, and it's got a little string attached to it. And this piece of cloth has medication on it that when it's put next to the cervix, it infuses into the cervix, and its job is to soften and dilate the cervix. So now what happens is this form of induction is really good when the cervix isn't quite ready for you to have a full-blown induction. So cervix, okay, uterus, cervix, this is the opening where the baby's going to come out. So it needs to open up. So during pregnancy, until you're ready to deliver, the cervix should be long, thick, and closed, okay? And what needs to happen is what actually happens to the cervix, so if you imagine it like this, is at the bottom of the at the bottom of the uterus, it basically thins out and moves away, and then the baby's head can come down. So in order for this to happen, it needs to thin, okay? So Cervidil is really good at that. Now, Cervidil isn't usually that painful. In fact, you might have a Cervidil induction for 2 or 3 days before they even start the next part of the induction. Cervidil can sometimes start contractions, but often the only thing it's doing is softening up that cervix for you. So that can be really mild. When you have a Cervidil induction, you're often allowed to go to the bathroom. You're often allowed to eat, all sorts of stuff. So it's one of those things that I would say doesn't hurt. Now, there was some use of Cytotec, which is a pill that can also cause contractions to start. The Cytotec is inserted into the cervix. In order to do Cytotec, you have to be 1 centimeter. So you have to have just enough of an opening that you can get that little pill in there. Now, that would go ahead and that medication would dissolve, and that medication could cause some contractions. So a little bit more strong, I would say, than the Cervidil. If the contractions start coming along, they can be stronger and more intense. One of the disadvantages of Cytotec is that you can't remove it. So with Cervidil, let's say it starts a whole bunch of contractions, we can just take it out, and that may slow everything down. With a Cytotec, once it's dissolved, it's in your system. We just got to wait for the medication to kind of be metabolized. So it is possible that you might have really intense contractions. Then, of course, there's Pitocin or oxytocin, and this is a medication we traditionally think of to augment labor, where it helps make contractions stronger, more regular. It's an IV medication. This is usually something that makes the contractions more intense and therefore more painful. So when you're having an oxytocin induction, a lot of women do associate with pain, and a lot of women will get an epidural to help with that pain. So it really just depends on what kind of induction. It also depends on your pain tolerance, okay? The final thing I would say about an induction is this. When you're in either a home birth, a birthing center, or in a hospital, your healthcare providers have to do vaginal checks. That's the only way for us to figure out how far along you are, how dilated you are. We have to take our fingers and we have to stick them into the vagina to feel this cervix, okay? Because this is a thick, long, thick, closed, right? I need to feel, is it 5 centimeters? Is it 6? Do I feel a head? Like, what's going on in there? If you don't have an epidural, you can feel all of that, and it can be uncomfortable. I try to tell women to relax, take a deep breath, try to just calm your body as much as possible, but it isn't comfortable. During an induction, as we're trying to figure out what's going on, we're inserting medicine, we do need to check some. Now, we try not to check a lot because we could introduce infection. That's why we use sterile gloves, but we still need to check. So, this is the other thing I would tell you is something that might cause you some discomfort during an induction. For those of you who are joining us, please feel free to put any questions that you have into the chat. We're just right now answering some of our questions that we've received this week. So I got a question about vaginal birth. So it said, I am pregnant with my second child. My first was born vaginally at 9 pounds, 5 ounces. I was induced at 40 weeks because they were nervous to have her grow more. Is it likely my next baby will be similar size? I really would like to do an unmedicated and not induced unless safety concerns arise. But my question is, should I be concerned about going over 40 weeks? Because that could cause an even larger baby that could get stuck, causing me to have an emergency C-section. Is my risk of an emergency C-section greater than the average person because of the size of my first baby, or because I did not have an issue the first time, will my risk be similar? So this is a fantastic question. It has a lot of pieces to it, but it's really good. So 9 pounds, 5 ounces is not your average size baby. This is a large baby, and there are risks with large babies. And the biggest one that we see is that the pelvis is not big enough for that baby to pass. And so that baby could get stuck, and that could be a medical emergency. Okay. And if the baby gets stuck while the baby's still high, a C-section is usually done with no issues. But there's something called a shoulder dystocia, which is our biggest fear. And a shoulder dystocia is where the head delivers, but the shoulder is stuck. Okay. So we can't get the shoulder out. This is a serious, serious, serious medical emergency. There are a lot of serious implications to the baby, and babies have and can die from this. So we need to make sure that we try to prevent this at all cost, which is why when babies get this big, we get concerned about whether a mom is going to be able to deliver them. So unfortunately, on average, your second baby is going to be bigger than your first baby. Is there really a way to tell you for sure? No, I think the studies say about half a pound to a pound. I will tell you that's exactly what I see in the hospital. It's about half a pound to a pound. It doesn't matter if you eat exactly the same and do everything right. You can expect your second baby to be a little bit bigger. Not universal, but most of the time. So yes, so now we have some concerns about that. Now, should I want an unmedicated and not induced birth? So let's see. Unmedicated, totally cool. There's no reason for you to need to get medicated just because you have a large baby. What I would tell you is this birth, for the safety of you and your baby, needs to take place in a hospital where an emergency C-section can take place. When you go there, while you may want to go without medication, you need to let them put in an IV. Okay? IVs are the little catheters that go into your vein that allow for us to administer emergency medications. I see so many women refuse an IV for a natural birth, and it is the scariest thing that I ever see when I'm in labor and delivery. If you start to bleed out, which is a hemorrhage, and we have a video on that we can link into the description, but if you start to bleed out with a hemorrhage, your volume depletes instantly. And when that happens, all of your veins flatten, and then we can't find a vein to put in a IV. If we do not have IV access, we cannot perform surgery on you. So every second that we're spending trying to find a place for you to have an IV is a second that we're not saving you or your baby. So I always beg patients who want to have natural births, let us put in an IV. We don't have to use it. It can just sit there with a little hep lock that just keeps it closed. But that way, if there's an emergency, and in the case of a large baby, there very well could be an emergency, we're ready to go. Now, some people might tell you to get an epidural because then you're truly ready to go for surgery. I would tell you, no, you do not have to do that. Epidurals can go in pretty quickly. And if we needed to with an IV, we can put you to sleep. Okay. If ultimately the most important thing is trying to allow you to accomplish your natural birth, and if not having a safe baby, we can do that with just IV access. Now, getting induced and going over 40 weeks. Okay. If your baby is measuring large, I would let them induce you at 39 weeks. Okay. So how can we make that successful? One of the things you can ask your healthcare team is what you can do ahead of time to ripen your cervix. If you're not in a high risk situation other than this large baby, you might be able to use evening primrose oil directly onto your cervix. You can do it yourself. You might be able to pump ahead of time. using a yoga ball, all these different things. And we have a video on inducing labor naturally. We can link that into the description. But if you're able to use some of these strategies to help you, kind of get your own cervix ready, then that might really help this whole process be successful and you to avoid a C-section, which of course, when we're induced, it does become a higher risk. One of the other things that I would tell you is ask for a cervidil induction. So remember, I just explained a cervidil induction. It's designed to help ripen the cervix and soften it and get it ready to go. And that's a really, really, really important thing. So if your cervix is ripe, when we go to use stuff like oxytocin and stuff, you're like much speedier delivery. And then while they're doing the cervidil, you can try to walk around in the hospital and do everything that you possibly can for your body. Is your risk of having an emergency C-section greater than the average person? If the baby is bigger, yes. If the baby is a similar size or smaller, no. Yes, I mean, if you have a bigger baby, it's going to be a higher risk. I will tell you the biggest risk that you would have with a baby that large is the risk of a shoulder dystocia. Shoulder dystocias are no joke, okay? In true emergency, if we can't get your baby out, one of the final things we will do is we will try to break the baby's arm to get the baby out. And that can leave the baby with a palsy, which is basically a nerve damage that could affect the baby's use of that arm for the rest of their life. And the reason why we sometimes have to do this is once the head has delivered, you can't push the head back. So we are left with very little choices at that point, which is why if you are these parents dealing with very big babies, you want to make sure you're taking the advice of your healthcare team very seriously and trying to do everything you can and being prepared for that cesarean section delivery. Another reason why I say get induced at 39 weeks. Every week during the last 4 to 6 weeks of your pregnancy, your baby can gain a full pound. So if your baby is 8 pounds at 37 weeks, your baby could be happen. For those of you who are joining us, much. Welcome to our live Q&A session. I'm Samantha, the maternity mentor, and we're just here, answering some of the questions that you've had and put onto the videos, and we'll answer any questions that you have live as well. So another question I got was about drying up milk. I breastfed for 3 days and was given cabergoline. My breasts are engorged and very sore. Do I still pump out the milk or not because I took the pill? So when you're trying to dry up milk, you want to go ahead and only take out the amount of milk needed to cause yourself to feel less pain. You don't want to take out any more milk than that. You don't want to pump because that's going to stimulate your breasts to make more milk. Using cabbage leaves and ice packs can help to reduce the amount of milk that your body's producing because cold basically dries up those ducts. Another thing you can use is peppermint. You can use peppermint deodorant, peppermint oil, all that good stuff. You can also chew on peppermints. Now, one of the reasons why I picked this question was the name of the medication that this person was given, cabergoline. Cabergoline is also called bromkriptidine, and in my opinion, it's one of the worst medications out there. So let me explain. Cabergoline is often given to women to help them dry out their milk, and it's very effective. Cabergoline is actually usually effective when dry out milk within 5 days. So why do I say it's bad? One of the things cabergoline does is it increases some of the neurotransmitters in your brain that affect your mood, and it makes you feel better. So you heard that right. It makes your mood better. So everybody's like, okay, so what's the deal? Because it dries up milk and it makes me feel better. The problem is you can only take cabergoline for about 7 to 10 days. And after that, you have to stop. And the second you stop that medication, all those neurotransmitters that were making you feel great, gone. And it is really big cause of postpartum depression. So this is a medication-induced postpartum depression. And if you're already struggling, this can make everything 1,000 times worse. In my opinion, cabergoline has catastrophic effects to the mood. There are many homeopathic ways to dry up your milk. There's other medications, for example, like Sudafed and Benadryl, that can also help to dry up your milk and are far safer for you and your mood than cabergoline. So I would make sure that when your healthcare provider is offering you any kind of medication, that you really ask them about the risks and benefits, because that's an example of a risk that I think is extremely serious and oftentimes is not told to women. Our next question, we had a couple questions this week on our vitamin D deficiency video, and they both were fantastic. So the first one was, can you share your opinion regarding the relationship between vitamin D and calcium level? So vitamin D deficiency is becoming an issue that's being highlighted much more in our society amongst all ages of human beings. So vitamin D helps us absorb calcium and phosphorus better. So without proper vitamin D, one of the things that can happen is your baby can develop rickets. So rickets is a condition where the baby's leg bones are soft, and so they end up bending, and they're formed in bent as they get older, and then they walk around with like a limp. It's easily preventable by making sure you have enough vitamin D. Now, the other thing is that just generally speaking, for all of your bone health, having vitamin D is very important. Now, we often think that, oh, well, I'm in the sun all the time, so I can just get vitamin D that way. Well, most of us aren't in the sun all the time, and most of us cannot get enough vitamin D from the sun. Well, our little ones especially can't get it from the sun. Remember, we're covering them up. Their skin is too sensitive to be exposed to direct sunlight. So we need to use stuff like sunscreens and sunshades and all sorts of other stuff, which prevents them from getting those sunshine rays and getting that sunshine to help convert to vitamin D. The other thing is that, the darker your skin, the harder it is for you to absorb vitamin D. So the lighter the skin, the easier, but the melanin, which is what makes us all like a different skin tone, well, the darker, the harder it is. So if you have really dark skin, that's going to make it harder and harder for your baby if your baby has dark skin. Now, why? Okay, so, baby gets bigger, you can give vitamin D. Well, you should be giving vitamin D drops from birth, especially if you're breastfeeding. Hear that, my breastfeeders. If you are breastfeeding, your baby should receive vitamin D drops. And you should be asking about the pediatrician in the hospital about how much to give your baby right from the beginning. Breast milk does not have an adequate amount of vitamin D in it. Even if you are taking vitamin D yourself, your baby needs this. If you're formula feeding, there is a little bit of vitamin D in the formula, but oftentimes babies can also be supplemented then. Vitamin D, though, is not only for your bones. Vitamin D has been shown to help our brain development and our brain processing, mood, cognition, memory. It's so important. It's one of the most vital vitamins that we will take. On top of it, for those of you who weren't sure, it's also a very powerful immune system booster. During COVID, in the height of COVID hospitalizations, every single COVID patient was receiving vitamin D in our hospital, because vitamin D is one of the pieces of many protocols that help boost patients' immune systems to help them get better. So when you're giving your baby vitamin D, you're also helping to boost their immune system. So back to the question, what's my feelings on vitamin D versus calcium? And, it helps it absorb better. There's so much evidence to say that that's what it's doing. But there's so many other reasons for you to be using vitamin D with your baby besides just that. So I am 100% a proponent of vitamin D. Now, the second question came in on the same video, and it said, do you have a recommendation for baby probiotics? If yes, how do you choose one? And are some brands better than others? So for those of you who don't know, probiotics are basically like bacteria that will help your belly work better. So we have bacteria that live in our guts and help keep our microbiome in order. Our microbiome is basically the homeostasis of our body that prevents us from having too much fungus or too much virus or too much bacteria. And it's very, very important. And when our microbiome is off, we don't digest things the way we should. We don't absorb vitamins and nutrients the way we should. Probiotics can help your baby if your baby's having a lot of colic and upset stomach. I love probiotics. I think they're one of the best things that we have out there for our babies. Whenever somebody comes to me and says the baby has colic, that's one of the first things that I suggest. So I love probiotics and I recommend them. You should always ask your healthcare provider to make sure they're on board. But usually pediatricians are on board. How do you pick one? So what most people at least in the United States, because some of you may be coming in from other countries, and if you are, please feel free to put your country in the chat. We love to find out who's been with us. For those of us in the United States, we love to pick organic. We love to pick organic. This is one of the things, homeopathic organic, this has got to be the best thing ever. And I'm going to tell you that that is probably not the case. So probiotics are not FDA regulated, not even for infants, okay? We kind of all know that about vitamins and over-the-counter supplements for adults, but they're not FDA regulated for infants. So what does that mean? If the FDA isn't monitoring this means nobody is watching out to see what ingredients are being put into that bottle. Nobody's watching to make sure the ingredients that are being put in that bottle are consistent. Nobody's watching to see the production facility, to see if it's clean, if it's orderly, what's going down the line ahead of it, what's, right behind it. So none of this is being monitored. There's no testing being done at all for safety, for efficacy, for anything. So most of these organic brands are small. They're small mom and pops, right? And they don't have a large customer base. Believe it or not, some of the cheapest vitamins that you will see over the counter are actually the safest and the most consistent. Now, why is this? Because these guys have been around so long and their vitamins are so effective that they've built up a sales base. Okay? People started buying them because they were cheap and they worked, so more and more people bought them. And providers like myself, if I know 100 of my patients are taking that yellow label bottle of vitamin D, what am I going to do? Tell my patients to go get the yellow label bottle. When my patients are pregnant and they want to drink tea, because just so you guys know, not all teas are FDA regulated either, so you don't know what herbs are in there, I tell them to go get plain old Lipton tea. Why? Because Lipton is such a large brand. So many people are buying it. If it was making people sick, we would know about it. If so many people are buying the yellow bottle vitamins, if they were ineffective or making people sick, we would know about it because so many people use them. So when it comes to your baby's probiotics, I would stick to known brands. I know that seems weird when we're all looking for the healthiest, the least chemicals, but believe it or not, there's other things at least in the United States, that they don't always have to put them on the label. So what you think might be organic might not actually be organic at all. So I usually honestly recommend Gerber. It's out there. Everybody knows it. I think one of the formula companies also has a probiotic. The name is escaping me right now. Oh, Enfamil. I think Enfamil might have one as well. I'm not promoting formula with that, but what I am saying is that, listen, these are big companies. If they're making babies sick, we would know about it. I own no stock in either one. Please feel free to use whatever your pediatrician recommends. And here's the thing. If your pediatrician says to you, use this organic probiotic, I would totally do it. Why? Because your pediatrician probably has a whole bunch of patients on that and knows that their patients respond well to it. So it's not this hard, fast rule, don't do organic. It's simply use the biggest brand, honestly, unless you've heard otherwise. Hi, Maria. Ooh, Canada. I hope you're not suffering from all of those wildfires. I heard it's been just really bad up there, especially on the West Coast. Can I start trying to induce labor as soon as I'm 37 weeks pregnant? That is a great question. So, generally speaking, I'm supposed to say no. However, if you have a midwife or an OBGYN who is relatively progressive, there's a lot of things you can do at 37 weeks to help get your body ready. So, for starters, pumping once a day for 10 minutes is a great way to help start to, start some contractions, but not put yourself into full-blown labor. And that's contractions. The point of Braxton Hicks contractions are to help, kind of ripen that cervix and pull away at it. A lot of the providers will let you start using evening primrose oil. These are capsules. You can swallow them, but some will let you put a hole in it and basically take that jelly and put it on your fingers and then kind of rub it on the inside of the vagina. That can help to ripen the cervix. I would tell you when you're pumping, sit on one of those big yoga exercise balls and roll around with your pelvis wide open, because this can help those contractions to be more effective. Usually if you're having a very healthy pregnancy, you can start to do some of these mild things early on. Once you hit, and then a lot of your midwives or OBGYNs will strip your membranes, and we have a video on that we can link into the description. That will also, they'll do that around 38 weeks. Now, 37 weeks is a premature baby. A lot of people don't realize this. And this is why we hesitate to tell women that they can start to do stuff naturally. You feel ready to go. You're big. You've been waiting all this time. We all have heard for years that 37 weeks we're ready to go. That's not the case. Believe it or not, at 37 weeks gestation, your baby still has an immature brain. It still has 3 full weeks of brain development to go. Now, what could this brain development possibly be? Because we see 37-weekers come out all the time. Well, this brain development has to do very specifically with temperature control and with the suck-swallow coordination. Now, why is the suck-swallow coordination so important? Because if suck-swallow is not regulated, if the baby's brain has not picked that up yet, your baby will have trouble breastfeeding. But what people don't realize is they can also have trouble bottle feeding. So we all think, oh, well, if my baby's not going to breastfeed, a lot of people will say, well, then I'll bottle feed. I'll give them formula. That doesn't always work. And what can be very frustrating for parents is to deliver this baby that they think is full term. It's actually a 37-weeker. And this baby ends up in the NICU because they won't eat at all because their suck-swallow coordination is so poor. Now, the other thing that happens between 37 and 39 weeks, which we take for granted, is the size. As I said earlier, during your last 4 to 6 weeks, your baby can gain a pound per week. That pound is more important than you realize, because most babies are going to lose between 10 to 13% of their body weight in the first 3 days. That's a lot of weight loss. Additionally, that weight that they're gaining is a fat. It's a fat that helps to keep them warm. When we're cold as human beings, we shiver. And when we shiver, we burn calories, and that eats up like our reserves. And these babies that are born at 37 weeks, they don't have any reserves. So if they're cold and they can't regulate their temperature, they're burning through glucose, but they don't have any glucose storage. Well, glucose is essential for brain function. And now if you have this baby who also can't eat right, you can end up with serious issues, and we have to bring the baby to the NICU for IV glucose to help correct that. So a lot of people feel like, oh, 37 weeks, baby's ready. Baby's not ready. We try only to deliver moms now if there's a true medical emergency. There's a few medical conditions like placenta previa is sometimes delivered early. But most of the conditions now, we try to wait until the very last moment. We are oftentimes inducing moms at midnight on the 38 and 6th day, so that technically they're really starting on the 39th week. However, healthy, normal pregnancies, your healthcare providers may let you do a little bit to kind of warm your body up, but we don't want to kickstart it too much. So I hope that helped, Maria. For anybody else who's listening, please feel free to put any questions you have into the chat. I'm going to go on with another question that we got. This was on our depression in pregnancy, and it said, what about Ambien during pregnancy? Is Ambien safe? So Ambien is a sleep medication, also known as Zolpidem. And Ambien is often used actually in the hospital for pregnant women who are having issues with sleep. Is it safe? There is one case of a mom who took Ambien early in her pregnancy, and the baby was born with significant congenital abnormalities or birth defects. However, it was a singular case. We don't study these medications in pregnant women, so it's hard to say. Ambien is a controlled substance. It's extremely addictive, so there is a risk of a withdrawal syndrome for baby. So that's something to take into account. That being said, I absolutely hate Ambien, and I don't think anybody should be taking Ambien. So I would not recommend it for your babies. First of all, we shouldn't be exposing moms to controlled substances. There are a lot of other medications that I believe are far safer than Ambien. The second thing is there is a risk with Ambien of sleepwalking. Now, we all kind of think sometimes when we hear that that's funny or it's an old wives' tale or something like that. Actually, it is not. There are people who've been known to drive cars in the middle of the night without remembering them. They wake up in different cities. They wake up in different houses. There are examples of people turning on their stoves and walking away from them in the middle of the night and starting fires. People have fallen. Ambien is very serious. It's a hypnotic, and it can do a lot of things to you. You're a pregnant woman. You can't afford a fall. You can't afford to wake up somewhere that you don't know where you are. Instead, there's so many other medications that can be used. For example, Seroquel. So Seroquel is an antipsychotic, which makes it sound super scary. Antipsychotics are often used for bipolar disease and for schizophrenia. But the nice thing about some of these medications is that super low doses, they can be used for anxiety, they can be used for depression, and they can be used for insomnia. And Seroquel is safe during pregnancy and while breastfeeding. And you don't have to take this super high dose. If you were schizophrenic or bipolar, maybe we'd be dosing you higher. But for what somebody might need for sleep, it's a super, super low dose. Another option is Unisom. Unisom is the over-the-counter sleep aid that also helps with morning sickness. If you combine Unisom with vitamin B6, it creates a medication called Diclegis, which is really good for hyperemesis gravidarum. And it's also calming. The B6 vitamin is calming. You know, in some cases, you can use Benadryl. Some cases, we can use a little bit of melatonin. So there's lots of other options. I would not recommend Ambien during your pregnancy. Our next question isn't a question. It was a statement. I loved this from this viewer. I thanked her for writing this. It came on the video that we've done on what to expect during the first 3 hours after a cesarean section. For me, the worst part was when all my relatives broke into the room right after my C-section. I wasn't able to even feed the baby because it was such a nuisance. Okay? So this comment highlights what I think is one of the most major issues that we face in the hospital for families that have just had a baby. COVID-19 had one unique benefit in the labor and delivery world, and that was visitors were not allowed to come in. And what you saw instead was families being able to rest together. Dads who weren't being interrupted and were able to have exclusive access to their babies. And I say dads, I should say partners. But partners who were able to just hold the baby when they wanted to and be able to learn all the things like diapering and, swaddling. Because oftentimes when grandma and auntie and best friend and whoever else comes in, everybody's taking over those jobs and dad doesn't get a chance to learn. And then moms are able to rest because they're not having to entertain all these relatives coming in. And they can honestly walk around the room topless while they're breastfeeding if they want to. When you're breastfeeding and your breasts are really sore, you don't even want cloth to touch your nipples sometimes. And in the hospital, the nurses don't care if you're topless. And sometimes that's what feels good. But you can't do that if your brother-in-law is in the room necessarily. At least a lot of women wouldn't feel that comfortable. You're bleeding, you're tired, you're supposed to rest when the baby rests. How can you do that if people are in and out of your room all day? And so I understood and saw how people were disappointed that, grandparents couldn't see their first grandchild and whatever. But ultimately, they were calmer. They were more rested. There was less anxiety. You saw less crying episodes, better success rates with breastfeeding, even better formula feeding rates, because women were able to do what they needed to do to recover, and partners were able to pick up the slack a lot easier. I think that if you are about to have a baby, one of the things that you should really consider is who you want to have visiting you. It's very tempting to say you want everybody there until you're in the throes of it. Whether you have a vaginal birth or a cesarean birth, you feel like you've been hit by a truck. Okay. Oftentimes, labors will last for 3 or 4 days unless you are a planned C-section. Okay. That's a long time. You've run a marathon and now you have this little human being that you need to take care of who is completely unpredictable. And babies get very disorganized when they're being passed around, when there's a lot of noise. Remember, your baby has never been exposed to anything. Everything is brand new. Every noise is irritating. All the lights are very abrasive to them. It's very cold out here, even when you put clothes on. And oh, wait, they've never had clothes on them before. They're not used to onesies and swaddles and diapers. All of this is very irritating to them. It's very disorganizing. And then if you have a whole bunch of people passing them around and kissing them and all these different smells from colognes and stuff, babies will become so disorganized. They won't feed. They'll have temperature instability. It's not good. So I would tell you that this comment from this viewer highlights an issue that we often don't talk about, or we don't realize is going to be an issue until it's too late. I encourage all of my new mamas to think about what you really want in that hospital. I think most families shouldn't have anybody come to the hospital at all. Really, truly. We have a lot of technology nowadays to allow us to do FaceTime and other ways to see our families and introduce the baby. But these people also can bring in germs. I mean, in the day and age of COVID-19, we also have to worry about what viruses might be coming in. And instead, if you take those couple days to recover, you can have people come to the house when you're ready and when you're on your own turf and you don't have healthcare providers coming in to check your bleeding and ask you about breastfeeding and all that stuff. So I thought that was a really good comment. For those of you who are joining us, I'm Dr. Samantha, the maternity mentor. I'm just answering some questions. We're getting close to the end. So if you have any questions, please feel free to type them into the chat. All right. We had a question. We get a lot of questions every week about bleeding. So I'm going to read some of these. My partner is bleeding on August 4th, brown, and only once, but again on August 12th, and it's kind of every hour. We're worried. We don't have money yet to check. Please help. My wife is 7 weeks and is bleeding. We went 2 times to the emergency room to do echocardiograph, and the baby is good. Everything seems normal, but she's bleeding again. We are so scared. Hi, I'm 4 weeks pregnant. I have pink discharge with slight cramps like periods. Is it normal? I have taken a doctor's appointment, but there's a wait. I have brown discharge and I'm 6 weeks pregnant. Is it normal? I'm 5 weeks pregnant today. I had light pinkish brown discharge. Is it normal or not? Please reply. I'm in great panic. Hi, I had my last period on June 13th. And July passed with no period. In August, I think on the 13th, I had a period like blood for 2 days, but stronger. It goes light. I'm confused about it. Hello, ma'am. I'm around 6 weeks, almost 7. Yesterday, I had light brown discharge with white mucus. The usual discharge seen during pregnancy. Is this serious? I am 6 weeks pregnant and I have cramping and spotting. Should I be worried? It's the start of my 5th week of pregnancy, and yesterday I got a small amount of brown discharge and mild cramps in my lower abdomen. Is there anything serious? I went to the doctor last week and I tested positive. The doctor said I should come back next month because he can't see anything for now. It's been a week and I see blood. At first it was light pink, but now it's red and I have back pain and I'm worried. I'm around 7 weeks pregnant, and when I was 4 weeks, I started bleeding bright red blood every day. I went for a scan at 4 weeks and 5 days. They saw the yolk sac. Then the bleeding stopped. However, when I got to 5 weeks, 5 days, it started again. I went for another scan 3 days ago. The baby has grown. There's a healthy heartbeat, and there's no bleeding around the baby. They say everything looks fine and not to worry, but I'm still bleeding, and it's 11 days now. I've been bleeding. The blood is mostly light pink, but sometimes red. I don't have any pain. It's noticeable only when I wipe after using the toilet. Is there anything I can do to stop this, or is this normal? So I read all of these comments at once for a reason. One of the things that I wanted for you guys to hear is that you are not alone. Bleeding is one of the most scary things that can happen during pregnancy. And it's one of the things that we realize can have serious implications. So bleeding is often associated with miscarriage, which is what everybody's worried about when they write these questions. So let's talk a little bit about it. Bleeding is common during the first trimester for many reasons that will lead to a healthy pregnancy. For starters, the hormones that allow you to have a healthy pregnancy also thin out the vaginal tissue. As a result, stuff like sex can cause you to bleed, usually spotting, which is little drops of red blood or little drops of light pink, okay? So this is very normal, very common, and it can go away. The next thing that can cause bleeding early on is implantation bleeding. So the egg is fertilized up in the fallopian tubes, but it has to travel down to the uterus, and then the egg has to implant into the side of the uterine wall. When that implantation happens, you might have a little bit of spotting or bleeding. The next thing that could be causing it is something called a subchorionic hemorrhage, and we have a video on that we will link into the description. But a subchorionic hemorrhage is basically the placenta is the organ that feeds your baby, and underneath that placenta, a little basically area of blood forms. And sometimes some of that blood seeps out and it comes out in the form of spotting. Now, you can have spotting also from a hemorrhoid. Remember, the hemorrhoids, as I said earlier, are those dilated blood vessels that are usually around the rectum that sometimes will burst and cause bleeding. And we don't realize that the blood is actually coming from there and not the vagina. You can also have spotting if you're having a miscarriage, okay, which is what most of us are worried. Some women will have a spotting 1 more month or 2 more months after becoming pregnant because they are actually had a friend who bled heavy, like going through pads all 3 of her pregnancies, all 3 trimesters. And she had 3 healthy full-term babies. So there are all different ways that pregnancy looks. Now, let's talk about the colors. Dark red, bright red, light pink, dark pink, clear, and brown. Brown is old blood. Okay, this is a sign that you were bleeding and you're not bleeding anymore. Okay, good sign. Dark red, it's where you're basically going from that active bleeding into non-active bleeding. Bright red is the sign of an active bleeding. And if you're having a lot, this is definitely something to be concerned about. Spotting is usually pink, and then clear is usually your normal vaginal discharge. You should not go from bright red to pink to bright red. That's considered also a big warning sign. Sometimes you will go through the stages and the colors for a resolving bleed, but you always want to make sure if there are any changes that you let your healthcare provider know. You want to let your healthcare provider know, even if you are very early on, if you're seeing any bleeding so they can check it out. There's various things that we can check and look for to see how the baby's doing. If you're early on, as in some of these questions saw, they'll do an ultrasound and they may see the sac of the egg, but they won't necessarily see a baby. This does not mean you've had a miscarriage. This simply means that the baby can't be seen on ultrasound. Ultrasound is not perfect, and there's many times that we don't see everything that we need to see on that picture. So sometimes we'll have to bring you back a second time. One of the ways we can check to see if you're having a miscarriage, if other things look like a miscarriage, is to check your human chorionic gonadotropin levels, or HCG levels, in your blood. This is the hormone that lets us know you're pregnant. What we do is we draw your blood, and 2 or 3 days later, we draw your blood again. If that level is going up, your pregnancy is going well. If that level is going down, then you're most likely having a miscarriage. You can't rely on a home pregnancy test if you're having a miscarriage, because you will still have the HCG, which is what those tests are looking for as well, in your system for a little while. If you're having pain, unfortunately, you do need to get checked out. A lot of people get concerned. You'll hear, I don't want to go get checked out. It's expensive, stuff like that. You could be having an ectopic pregnancy, which is a medical emergency and requires emergency surgery. So if you are having pain with bleeding and you're early on in your pregnancy, you need to get checked out. One of the things I need you to know, though, is that you can bleed during your pregnancy and have full-term healthy babies. The most important thing is to let your healthcare provider know and follow their advice. Ask if you're allowed to have sex. Ask if you should be resting. Make sure you're drinking plenty of fluids. Make sure you're sleeping well. Make sure you're eating well. Make sure you're taking your prenatal vitamin. You need to be as healthy as you possibly can when you're bleeding during pregnancy. I have one other question that I want to get to today. We have a couple other questions that we'll probably get to next week. But this was a question about antibiotics. I'm 17 weeks pregnant, and the doctor gave me co-amoxiclav 500/125. I just want to ask if these are safe for pregnant women. For any of you that are here, if you have any questions, pop them into the chat now. So amoxiclav is amoxicillin and clavulate. I'm not sure if I'm saying that right. It's 2 different antibiotics combined into one pill. Antibiotics are medications that we use to treat bacterial infections. They will not treat viruses. So, for example, this would not treat COVID-19, but this potentially could treat an ear infection or strep throat. These medications are used for a variety of reasons. The most important thing you need to know is that untreated infection can lead to sepsis, and sepsis can seriously hurt both mom and baby. When you're pregnant, you're immunocompromised, so you tend to get infections more easily. So it's very important to treat these infections. You want to talk to your doctor always about the risk versus benefits of any medication. Once you've decided to take an antibiotic, you need to take the entire course of the antibiotic, not just until you feel better. So if I have strep throat, I get a sore throat, I feel sick. I go to the doctor, he swabs my throat. Congratulations, you have strep throat. Here's an antibiotic like this amoxicillin clavulate, right? So I go to take it, and about 24 hours later, guess what? I'm going to feel amazing. My sore throat's gone. I don't feel like I'm sick anymore. Everything's great. That's because the antibiotic started to kill off the bacteria. So it's doing its job. And now I have less bacteria in my system, so my body feels better. But guess what? There's still more bacteria there. And that bacteria, if you stop the antibiotic, it's just going to grow back, and it's going to be stronger because it now knows what you're going to come after it with. So it develops a resistance. That's how we get antibiotic resistance. And then if you develop that resistance, now you're going to take this whole course of antibiotics that don't work, and now they're going to have to give you something stronger. And eventually some of those stronger medications might be more harmful for you or for baby. So when you are given an antibiotic and you choose to start to take it, you need to take the entire thing. You are doing better for your baby to take all of the medication versus some of the medication, okay? Amoxicillin clavulate is safe for use during pregnancy. You can use it in all 3 trimesters. It's an extremely effective antibiotic, and it's really can be used for a wide variety of infections. So that was a great question. So I want to thank you guys all for joining us tonight. My name is Dr. Samantha. I am the maternity mentor. We are here every Monday at 9 p.m. Eastern Standard Time to do a live Q&A session where we answer questions for you live in the chat, like Maria's question, as well as any questions that you submit onto our videos. We try to get to all of them every week. Please remember to subscribe to the channel, hit the notification button so you can be notified of our latest content. We have a lot of good stuff coming up. Please also remember to hit us up on Facebook, Instagram, and Twitter for additional content. We will link those into the description below. Share this channel with your friends and family, okay? We really appreciate all of your support. We love being here with you. Please make sure you let everybody know that we are here every Monday at 9 p.m. Eastern Standard Time. With that being said, I want to thank you all for joining us from wherever you are. My name is Dr. Samantha. I am the maternity mentor. Bye for now.